Welcome to the Explainer. Today we're going to break down two of the most common causes of painless scrotal swelling, hydroceles and spermatoceles. We'll get into what they are, exactly where they come from, and maybe most importantly, how they're treated. So let's dive right in.
Let's start with a number that might actually surprise you. 1%. That's the estimated rate of hydroceles in the adult male population. It's not exactly something people chat about over dinner, but it's a condition that affects a pretty significant number of men, especially as they get older, often popping up after a minor injury, an infection, or some kind of inflammation.
So what exactly is a hydrocele? I know the name sounds a little complicated, but the idea behind it is actually really simple. Just like you see here, the testicle is naturally wrapped in this two-layered sac. Well, a hydrocele is just a buildup of clear fluid in that little space between those two layers. That's it.
Okay, but to understand why this fluid can build up in the first place, we have to go way, way back, all the way to fetal development. Believe it or not, the origin story of a hydrocele is totally wrapped up in the incredible journey the testis takes before we're even born.
This timeline really shows you that incredible journey. See, the testes doesn't actually start out down in the scrotum. Nope, it begins way up in the abdomen. And then, over several months, it gets pulled downward, traveling right through the abdominal wall until it finally settles into its final spot. That whole process is usually done by the 9th month of gestation.
Now, here's where it gets super interesting. As the testis makes that trip down, it doesn't go alone. It actually drags a little pouch of the abdominal lining along with it. And as it travels, this pouch picks up layers from the abdominal wall, kind of like putting on multiple coats for a long journey. And it's this very pouch that's at the heart of what becomes a hydrocele.
In this picture, it just perfectly illustrates what happens next. After birth, that little pouch is supposed to seal itself off from the abdomen. As you can see in image A, when it does that, you can still get what's called a non-communicating hydrocele. That's where the local sac just produces and traps its own fluid. This is actually the most common type in adults. But if the pouch doesn't seal, like in image C, you get a communicating hydrocele, where fluid can actually track down from the abdomen. That's a lot more common in kids.
So, let's say someone notices some painless swelling down there. How does a doctor figure out if it's a hydrocele or maybe something else? Let's walk through how they get to the bottom of it.
Thankfully, diagnosing a hydrocele is usually pretty straightforward. It all starts with a physical exam, of course, but a doctor's going to use a couple of key tests just to be absolutely sure. So one of the classic bedside tests is called transillumination. It's basically just shining a bright light through the scrotum. If it's clear fluid, it'll glow, which is a really good sign. But the definitive tool, the one that's non-negotiable, is the ultrasound. And that's because it doesn't just confirm that there's fluid. It most importantly lets the doctor get a good, clear look at the testicle itself to make sure there's nothing more serious going on. Okay, so the ultrasound confirms it. It's a simple hydrocele. What happens then? Well, treatment is usually only considered if the hydrocele is causing discomfort, if it's gotten really large, or if it's cosmetically bothersome. Let's break down the options.
Broadly speaking, there are two main paths you can take. For patients who aren't great candidates for surgery, there's a non-surgical option called aspiration and sclerotherapy. But for most adults, the gold standard, the most effective and definitive treatment is a surgical procedure called a hydrocelectomy.
Let's look a little closer at that non-surgical method. As you can see, it's a multi-step process. First, all the fluid is drained out with a needle. Then, something called a sclerosing agent, basically a substance that's designed to create a controlled inflammation, is injected into that now empty sac. The whole goal is to make the walls of the sac stick together, so there's no more space for fluid to collect. But, and this is a big but, this procedure comes with a really important warning.
So this is the crucial point, and the source material is crystal clear about this. This technique should never be used for men who might want to have kids in the future. Why? Because there's a big risk that the inflammation it causes could damage or even block the epididymis. Those are the delicate little tubes that are essential for transporting sperm. This is an absolutely critical thing to talk about when considering treatment.
Now, when it comes to surgery, surgeons have a few pretty clever techniques up their sleeves. The goal is always the same: stop that fluid from building up again. As this table shows, they can do that by either cutting away most of the sac, kind of bunching it up with stitches like a drawstring bag, or, in a really elegant solution, by turning the whole thing completely inside out.
And this right here perfectly illustrates that last technique, which has the brilliant nickname, the bottle operation. As you see in image A, a small cut is made in the sac.
Then, the testis is gently pushed through that opening, as you see in B. This literally turns the entire sac inside out. So now, the surface that was producing the fluid is on the outside, where any fluid it creates can just be easily absorbed by the body's tissues instead of getting trapped. It's such a simple, elegant solution.
Now, a hydrocele isn't the only cause of a painless scrotal mass. It has a very close cousin called a spermatocele. And while they can feel kind of similar, where they come from is fundamentally different.
This slide lays out the key differences perfectly. A hydrocele is a sac of clear fluid around the testicle. A spermatocele, on the other hand, is a cyst that forms directly from the epididymis. That's the network of tubes behind the testicle. And that means its contents are different. It's a cloudy fluid that actually contains sperm. And when a doctor examines it, it feels like a distinct mass, separate from the testicle itself.
And you can see that difference perfectly right here. This illustration shows the spermatocele as this distinct, cyst-like thing coming right off the top of the epididymis, totally separate from the testicle down below it. This is exactly why it feels different during a physical exam and why it's a completely different diagnosis.
Okay, we've covered a lot of ground here, from fetal development all the way to some really cool surgical techniques. So let's just boil it all down and recap the most important points to remember.
So here's the bottom line. Hydroceles and spermatoceles are common, and they are typically benign conditions. The diagnosis is locked in with an ultrasound to make sure nothing serious is being missed. And for a hydrocele, surgery is the most definitive fix. But the single most vital takeaway is this. If you're thinking about any kind of treatment, especially that non-surgical one, you have to have a thorough conversation with your doctor about the risks, the benefits, and the potential impact on future fertility. That discussion is absolutely essential.
Understanding the what and the why behind these conditions, that's the first and most powerful step. It replaces any uncertainty with knowledge and empowers you to work with your doctor to figure out the best path forward for you. Thanks for watching.